Good morning, good afternoon, good evening, wherever you may be, this vast continent and world of ours. I welcome you to one of our webinars today at a Global Healthcare Public Foundation. I'm glad to have you this afternoon or morning or evening, again, depending on where you are. We're going to be looking at safety in medical laboratories. In today's age, medical laboratories has suddenly been sprung to the forefront of everything that is happening in medicine. Many people never knew of the medical laboratory and the diagnostic work that the medical laboratories do. But since COVID-19, with everybody wanting to have a test result, wanting to travel, wanting to be sure the difference between their flu and the SARS-CoV-2 virus, suddenly the medical laboratories have come to the forefront. In every country that I have been associated with, and there are different task force or nerve centers or control centers, depending on how they are called in the different countries, they've all developed a specific pillar for health and a specific pillar or sub-pillar that looks into laboratory medicine and the diagnosis of what is going on in laboratory medicine. So again, my name is Killian Songwe. I'm the president at the Global Healthcare Public Foundation. And I'm glad to have you this afternoon to join me as we talk about safety in laboratory medicine. So just for starters, the standard that I'm looking into today is the International Organization for Standardization Standard, the ISO 15190, and this is the latest version. This is actually February of 2020, that's this year. I know we've been in lockdown for such a long time, nobody might even remember that there was a new standard released. But this standard is actually heavily based and made primarily for the ISO 15189, which is for medical laboratory quality and competence. So when we look at the safety in medical laboratories, it goes hand in hand with ISO 15189. Again, that's a new standard. And we'll talk about the ISO 15189 very shortly. But ISO 15190 requirements for safety, which is what we want to look at today. I always want to start off by just giving you a quick background into what the International Organization for Standardization is doing in this field with regards to different standards. And if we looked at laboratory medicine in general, there are two things here. First of all, I bring your attention to the ISO. It says ISO CD 15189. And you note that in that particular circle, it has a dot as opposed to a check. Basically, what that means is that particular standard is under revision. And I want you to take note of the nomenclature 3060, because I'm going to speak to that nomenclature in a little bit. Because many people go onto the ISO website and they will see different sets of nomenclatures, 3060, 6060, or 2030, or 2060, and they really don't know what it means. So I'm going to introduce that to you as we go on. And then, of course, there is the ISO 15190, the 2020 edition, which is for medical laboratories requirements for safety. So going on to talk about when it talks about the international harmonized stage codes, and this is very important to be able to know where in the total process a standard is. So there are about 9 different stages. It starts with 00, which is the preliminary stage, the proposal, preparatory, committee stage, inquiry stage. And then as you move to the left, from right to left, you have the sub-stage and the decision stage, which is the 90 category and above. The sub-stage is from 00, 20, and 60. So when you see a standard with, say, for example, it says 3060, basically what does it mean? It means that that particular standard is now close to 40. But once you see a standard with a 90 on it, it means there's actually a decision that has been made to that standard. And as we look forward, as I said, there are 9 stages. There's also an approval, and then there's a publication, and then a review stage. So you could actually see a standard that would say something like 6090. Basically, it's in publication stage and a decision has already been made, so it's a full standard. Or you could say 6060, which means completion of that standard has been done, voting has been done, and the standard is ready for publication. So it's important to note, because when you look at the standards, they all come with such nomenclatures next to them, 2060 or that kind of a thing. It's important to know where they are. Then, of course, there is usually the technical committee that is working on that standard. And in this particular case, the technical committee working on the standard we're interested in here is the technical committee 212, which is the same technical committee, or the TC committee, that is working on the 15189. So that's just a quick and important background as we look at the standards and we talk about what is going on. So let's jump into ISO 15190 and the 2020 edition. The ISO 15190 is slightly different from most of the other standards. It's not a high-level standard, so it does not fall into one of the standards that could be integrated to form an integrated system, because it has over 18 main clauses to this standard. And we're not going to look at all the clauses here. What I'm trying to do today is actually just to do a quick, nice introduction to the safety elements that are required for medical technologies. So we know, as managers in medical technology in the field, or as executioner medical technologists on the bench, some of the basic things that are required to ensure reliability and safety of the work that we do in the diagnosis of clinical results. So all international organization standardization forms, they all have the same opening. They all have a scope, they have a normative reference, and then they have terms of definitions. And then from that point, they might be different as they go down. So to ISO 15190, what is the scope? It says the document ISO 15190 and this edition specifies requirements for safe practices in medical laboratories. So the boundary is very clear. This is medical laboratories. And its normative reference in this case is ISO 15189. And just by virtue of the fact that this is its normative reference, it also goes on to use a lot of the definitions out of the ISO 15189 as part of this definition list. So ISO 15189, again, medical laboratories requirements for quality and competence, because we're talking about safety in the environment of quality and competence of medical laboratories. So the next thing here is terms and definitions. As I said earlier on, it looks at the same terms and definitions, or almost the same, not exactly the same, because it's also based on the ISO 9000 for its definitions as well. But because we are in the COVID era, and there are a number of definitions that have been used, people hear acronyms as BSc and those kinds of things that I want to just quickly go back into. But first of all, let's talk about biological agents. Because this is language that has been used, that continues to be used, and people need to have an appreciation of what they mean at different times. When we talk about the biological agent, we're talking about any microorganism, including those that are genetically modified, and these are things that could be done in the lab, cell cultures, human endoparasites. These are things that could actually be generated in the lab. And then we talk about the biological safety cabinet, which basically is an enclosure in which a lot of the biological work is done when we're dealing with biological agents, which I just spoke about a few seconds ago. So having a biological safety cabinet is important, but there are also different classes of biological safety cabinets, whether it's level 1, level 2, level 3, which is very important to note, depending on what organisms you're working with. Then there are these other sets of terms, decontamination, procedure that eliminates or reduces. This is very important to note, the elimination or reduction of the microbial or toxic agents, as opposed to the disinfection process, which reduces the number of microorganisms. But most important, as we are in the COVID era, is actually to think about sterilization as well, which is actually ensuring that whatever the product or produce is in terms of waste is free of all microorganisms. This is usually done by autoclaving. So having an autoclave in your medical laboratory becomes very, very important when we're talking about COVID-19 or the SARS-CoV-2 virus and treatment or testing of any of the byproducts. And also how you manage the waste when we are dealing with this. So just a few definitions that we need to keep in mind as we go forward. But So talking about the medical laboratory and the safety of both personnel that work in the laboratory and visitors to the laboratory is important. So there are just preliminary considerations that need to be taken into consideration when you're going to design a medical laboratory. If you want to start from scratch, of course, there are a number of them, but just for the purpose of a quick discussion, we need to have the scientific staff and other users of the lab in the discussion when we start, consideration of what biological risk and the biological risk management committee needs to be available. What certification entities are going to be concerned depending on what levels of microorganisms are going to be managed or treated in this laboratory. Then of course there is the public emergency, which is very important because if there is a breakout, the response to your medical laboratory has to be known so that if the people have, the response team is going to come to your lab, they need to know what kind of hazmat suits they should be in before the show. You don't want people responding to an emergency in your lab and then they just show up in plain clothes and then they get exposed. So these are very preliminary considerations that must be in place as we design a lab. Then there are the general design requirements. Basically, when you're looking, you want to ensure what kind of microbiological or chemical, or is it going to be radiological waste and hazards that are going to be dealt with, because there are different responses in terms of the structure that is going to be put together. And then we want to assess risk in the technical work areas. What are going to be the different exposures of the person or persons that will be working in that space. We also want to take account for safety of all laboratory stakeholders. This is staff, as I said earlier on, patients. Sometimes we have patients have to come into the lab to get a phlebotomy procedure done on them. There are visitors that will come into the lab, whether they come in as auditors, assessors, or personal visitors to staff. Maintenance staff, the people who have to clean out the place. This is all very important to ensuring that it's in good shape. Again, when we think about general design, and I'm just touching on a couple of the key things that we need to look into. There is air circulation. A lot of our laboratories actually serve as a dual entity. So they actually serve as an administrative place, and at the same time, they serve as technical space. And so you end up in a situation where you have the same vent duct running through the technical space and running through the administrative space. What does that mean? It means that anything that is either the administrative space could end up in technical space, or things in technical space could actually end up in the administrative space. So we have to ensure effective separation between these two areas. Then also, there's something as simple as what does the bench top look like? Because it could actually serve as a medium for retaining microorganisms that shouldn't be. But also, depending on the nature of the bench top, you can actually start up another whole chemical reaction, which normally should not have been if you had the right durable and readable, cleanable bench top, which is very important to use or to have. Still looking at designing for safety, there is laboratory security. Again, talking about COVID-19. COVID-19 is actually classed as a level 3 microorganism. So that means there are restrictions around it. And these restrictions are important because we're thinking about loss, we're thinking about death of vials of COVID-19 or misuse of these vials. So there has to be control for unintentional exposure so that we know that there is a certain security level around it. We have to also take into consideration risk assessment and security programs to determine what levels of microorganisms we're working with and what are the mitigation strategies that we have to use. So these are things that need to be looked at. There is also physical security. Physical security is important because we're talking about lockable doors. We're talking there are very many biobanks that are now storing COVID samples. We have to ensure that they are locked, that there is access control for specific personnel to different levels of what is actually going on. There is also something as important as the inventory. Inventory is key. We need to know what hazardous materials we have and how they've been stored, because that inventory actually allows us to know if there is a potential of it being lost or being stolen, and if there is a public health consequence from us not knowing what is in the inventory. And then, of course, information management and security, access, confidentiality at different levels. Who needs to know what, when, and where, and how the microorganisms are being kept. And then there is incident and emergency response, investigation and corrective actions. So there needs to be a proper plan that is going to be put into place for if there is a sudden incident, what happens? If there is an emergency response, what is going to be implemented? How is it going to be investigated? And what's the corrective action to ensure that this incident or accident does not occur again in the future? General considerations to safety management program. This is actually having a proper program in place to ensure that there is safety in the medical laboratory. And again, as I said earlier on, I'm just highlighting a number of things that we need to have in consideration as we look at the safety of our medical laboratories. And again, this takes into consideration the patients, the visitors, the staff, and any other stakeholder who might be in the space. As I said, there might be auditors or assessors that come into the space. We need to think about hazard identification and what are the different risk assessments that could be done. What kind of chemicals are available? Because some of these chemicals might actually interfere with the reagents that we have in our laboratory. And that interference is very, very risky because we could end up with false negative results just because of the chemicals that are actually in the space and their unintended reaction with reagents, especially when we're talking about rapid detection cartridges. There is a very high risk. We also need to look at equipment safety. Transport of samples and hazardous material is a very important thing. There are licenses to be obtained. Housekeeping practices, who is doing it, what level of training have they gotten? And above all, record keeping is very key because record keeping of the levels of education, the training that has gone on is key in ensuring and investigating when we have problems. So management requirements between the management program, of course, always, there needs to be very clear procedures that look into what are going to be the signs or symptoms of exposures, what are the risk assessments that need to be looked into, and especially exposure minimization procedures, what is going to be done. And these are very simple things like putting on PPE all the way to elimination of the risk. And then obtaining procedures and ensuring that the safety data sheets are available for all the key materials that are going to be used and ensure that employees have access to this 24 hours so that they can have a quick response for their own safety. Also important is disposal of chemical waste. That is very important. How do we dispose of soluble chemical waste? So in most of our practices, there is almost a clear guideline on how to dispose of our solid medical waste. So this includes, in the case of COVID, the vials, the transport vials. It includes the swabs. It includes the trays on which, the assay trays on which the PCR test is carried out. But what actually happens to our soluble waste? What happens to the liquid waste? This disposal needs to be brought into consideration and looked into because it also has direct consequences to the staff, to the visitors, and to personnel stakeholders with the laboratory. Management responsibilities, the safety of all employees and patients and the laboratory visitors is the primary responsibility of management. Management needs to ensure that the safety for guests is actually there. It also needs to make sure that there is a scientific manager in place with the ultimate responsibility for ensuring that the facility has the designated bio-risk management responsibilities to execute the requirements of ensuring the safety of the lab and the visitors to the lab. So management of staff health. This is very important, and actually I make allusion to the standard actually refers to the ISO 45001, which is the occupational health and safety. When we look at occupational health and safety, there is the safety component to the whole occupational health piece. And so when we're talking about management of staff health, we need to take into consideration things as immunization. And one that a lot of the time we don't think about is the psychological hazard. What are the personal factors that contribute to excessive stress? Again, in the COVID era, all of a sudden, We have labs that are testing 3 times their original testing volumes. That's a stressor. That will create stress on the staff. But that has to be looked into to ensure the health of the staff if we're talking about it from an occupational health and safety point of view. Employee impairment. Over time, this impairment occurs, and that's why there is a need to ensure the competence of the staff. It's very important to make sure that we have competency exercises because employee impairment happens over time. There becomes a time when the activity becomes redundant, and then there is employee impairment as well. Laboratory safety officer, this is a very important person when we're talking about safety in a medical laboratory. And when we look at ISO 15190, it says an appropriately qualified and experienced. So there is actually a combination of qualification, experience, and also there is the need for training that makes this person the laboratory safety officer. And they report directly to laboratory management. Laboratory management could be a team of people, it could be an individual, depending on the complexity and size of the different laboratories. And so those are things that I spoke earlier on about the scientific manager, and now I'm talking about the laboratory safety officer. And these are very different people with very different responsibilities in the laboratory. Then, of course, there is the safety manual. The safety manual, we piggyback on ISO 15189. There is a quality manual. The quality manual in ISO 15189 basically is the guiding document that allows us to know what is going to happen, A, from the management perspective, and B, from the technical perspective. So it is with safety as well. In safety, there is the safety manual, which has to be readily available in all work areas to people who are working in the lab. But most importantly, when we talk about the safety manual, it has to be specific for the laboratory's needs. Because it's very easy for us to adopt a safety manual from a colleague's lab or from a friendly lab or that kind of thing. But we have to make sure that the scope of testing in our labs, our biological hazards, we need to know what they are so that we actually adopt a safety manual that responds to our needs within our laboratory. And again, I just list what we need to have in our safety manual: the safety policy, which is basically a management statement, fire prevention, sorry about the double B there, electrical safety, chemical safety, if you're in a bigger space with a lot of ancillary services around you, radiation, biological hazards, and then, of course, hazardous waste disposal. And I particularly call attention when I talk about hazardous waste disposal. I'm particularly looking at what we're going to do with our soluble waste, because that's one area where, as I go around the different countries and different labs, I always find this as a very, very weak area. And it's an area that a lot of attention needs to be paid to because of the potential of big contamination with a huge public health consequence. Safety program audits and inspection, again, based on ISO 15189 for quality and competence, it borrows the same language. It says at least annually. So there has to be an audit that is going to be done at least annually. And in 12 months, and 12 months is going to depend on your laboratory and how you want to count 12 months. It doesn't necessarily say it's going to be January to December or it's going to be June to July. It's whatever your quality management system decides as your 12-month period. And then it talks about laboratory management. And laboratory management, again, remember that the safety officer reports to laboratory management. So laboratory management shall be responsible for ensuring that safety inspections are undertaken, because this is their primary function in ensuring the safety, the health of, again, the visitors, the patients, and all other stakeholders to the lab. Another very important element for medical laboratories and safety is the element of records. Records shall be kept in accordance with ISO 15189. In ISO 15189, clause 4.13, 4.13 is all about records. They're about, if I remember well, there are almost 13 different elements in ISO 15189 on records that need to be looked into whether it's a record on incidents, a record on accidents, records on EQA, records of internal quality control. All of these records need to be kept, and they shall be noted. It shall be noted that international, national, and regional regulations or guidelines may apply. So the ISO 5189 is actually a minimum standard for you to be able to implement. So you could have something that is more stringent. So if you have regional regulations that are actually more stringent, then those regional regulations that are more stringent actually supersede any ISO standard that is going to be out there if you're going to present yourself for any kind of third-party audits or assessments. Then we have to, again, I mentioned earlier on, occupational health and safety. Injury and adverse incident records. Again, this is heavily based on ISO 45001. Then there is hazardous waste records. Yes, we have to have an inventory. We spoke about inventory earlier on of what are the hazardous materials that we have. Now we also need to talk about what is the volume of this hazardous waste as it goes out. That's a requirement which a lot of laboratories that I know are not actually maintaining. It's very important. We need to know what volume of hazardous waste is actually going out of the laboratory. Because if we don't know what that volume is, that volume could actually be seeping into the public, and then it could easily become a public hazard. And again, we're looking at where we are with the COVID-19. If we don't have a very clear understanding of the volume of waste that is generated as we go through all the testing that we're doing, PCR testing, rapid detection tests, and all the volumes of material that we have that is going on, there needs to be some kind of control of this. Otherwise, it's going to seep into the public for one reason or another, and then we have another public health emergency. In safety, there is also training and orientation of our new staff and people who come into the area. And when we're talking about people who come into the area, it could be technical and administrative people. And there is nothing like I've been working in a laboratory before. Every laboratory is different. It could be low complexity, it could be medium complexity, it could be high complexity. Say, for example, our PCR labs today are very high complexity labs, and they require a certain level of stringency to be able to move from one area, sample reception to processing to actually resulting. There are different kinds of PPE that need to be put on. So there is an orientation that is needed. Transport, understanding how transport happens. Maintenance of equipment, maintenance of the space, housekeeping, how is the cleaning going to be done, what detergents can or cannot be used. In a lot of our facilities, we do have students who come into our facilities. There has to be a proper training and orientation to receive the students, how they get into the space. Contract staff come in and out on short-term basis. Volunteers, there has to be a proper training and orientation of these people as they come into our space. Because once they come into our space, going back to the beginning, laboratory management is responsible for their safety. Because now they're in a space and we need to ensure that there is no harm that actually befalls them while they're at our space. So some of the elements of training, we have to have safety training, a proper safety training program, which also needs to be reviewed to ensure that it is actually effective. Fire prevention and control training. I'm always amused with this one because I would go around and I would ask different labs to say, did you have a fire prevention and a fire training? And they'll say, yes, we had a nice fire drill. And I said, do you have any records? And at the top of the record sheet, it always says boardroom. And I said, oh my God, you had your fire drill in the boardroom. And then we all go into a big laugh. But yes, there is a thought process that needs to go into some of the things that we do, because when somebody shows up as an auditor and an assessor, it actually says something about the level of involvement with the people who are there. Then first aid training. First aid training is very, very important. We need to have knowledge on what is the first response before we can take you to triage or take you in for care. Hazard identification and risk assessment. This is a very important thing because hazard identification, we need to be able to appreciate what we have in our laboratories. We need to have the MSDS sheets. We need to know what the job hazards are, the risk assessment. And actually, if I go on to the next slide, actually, the risk assessment, it actually talks about what is the process of eliminating the different hazards in the space. So you start off with something as simple as having the right PPE. And we've spoken so much about PPE with COVID. Protect the workers with PPE. This is the right protective gowning, gloves, lab coats, shields to separate them from splash. Administrative controls, just change the way people walk. It's very important. Then there are simple things as engineering. Isolate people from the hazard. You could change the way in which people actually access the space. So some people have biometrics which require them to either place their thumb to be able to have access. But in the era of COVID, you might want to re-engineer, and instead of placing your thumb, you might want to have a key card which you could actually flash at the same biometric, and it allows you to enter. And then substitution, replace the hazard completely. What is another element that you could use? What is another reagent that you could use that actually replaces the hazard? And then most important of all, physically remove the hazard if that is how you're going to manage the risk associated. So there is biosafety and biosecurity, and this is a whole other standard by itself. That's the 35,000 standard. The standard that looks into biosafety and biosecurity. So already we've already delved into about 3 or 4 different standards, and we're still just talking about medical safety in medical laboratories. But all of these standards actually have to come into play at one point or another. Because either you're talking about engineering control, you're talking about administrative controls, or you're looking at what are the hazard groups that are associated. How do you come up with an inventory? You know what your different hazard groups are. Containment levels, I spoke about biosafety cabinets at different levels. Then there are aerosols, the issues of aerosols, how do you manage that? Decontamination of the space, biological safety cabinets, and biological spills. We all have a spill kit in most of our labs, but does the spill kit that we have today, does it respond to every microorganism that we have? Is it the right biological spill kit that we have? These are things that the safety officer has to look into, and it is management's responsibility to ensure that we have the right tools. And some other more mundane physical hazards that are in our space, and more often than not, we go around without actually paying attention to. There is something as dangerous as compressed gas. In a number of facilities, we have compressed gas tanks actually standing on their own with no chains, nothing to secure them. And I hate to think about one of those tanks coming down to the ground and what kind of an explosion we could easily have. But that's something very important to note. In most of the other facilities, in some other facilities I see, a lot of their compressed gas is actually kept out of the facility and tubed in. And in some much smaller facilities, the compressed gas is actually in the space, but it has to be properly retained, because that's a very severe accident. Then there are issues of ventilation, which we looked in at the beginning, indoor and what's the air quality if you're dealing with formaldehyde, for example. That creates a huge problem because you have chemical fume hoods that you have to use, safety cabinets at different levels. Then canopy hoods. I just spent a second on canopy hoods because I'm not sure people are familiar with canopy hoods. But a canopy hood, the most easy example I could give you, if you're working in a timber shop, there is usually a small bag that is put behind the machine to absorb the dust as it comes out. That's literally what a canopy hood is. So you would use a canopy hood in a laboratory if you're trying to contain heat. As heat comes down from a different set of equipment, that you could use a canopy hood to be able to absorb that. Or you could have slotted benches, which basically is just outlets that allow for heat to be able to escape exhaustion pipes that you could have in your laboratories. And then, of course, electricity. In most times when you talk about physical hazards and you talk about electricity, the first thing people think about is the availability or the non-availability of power. No, but we have to think about having the right sockets. Is it a 3-phase power or is it regular power? Is it exposed? Is it under the bench? Is it properly sealed? Because that could easily become a very, very dangerous hazard in the wrong place if there is exposure. Then, of course, there is radiation safety for people working in the blood banks. Every now and again, you might have to radiate a unit of blood. In some facilities, this is taken over to radiology to be done. And of course, the ones that we have come to be very familiar with, temperature and humidity, especially as we transport samples from one place to the next. There are very stringent guidelines around how to transport COVID samples, whether they go into freezing or they're kept at room temperature for less than 5 days, how they're going to be transported. This needs to be looked into because it poses a physical hazard both to the lab staff and to the client, because it's going to result in a false positive or a false negative result depending on the situation. Then, of course, there is the element of noise. Noise is a hazard in and of itself without people noticing. There are also undue pressure that could actually happen in the space in which you're working. Then as we move further, there are the elements of emergency preparedness and response. Again, emergency preparedness and response is actually something that comes out of ISO 15189. What if, or should there be a circumstance when you cannot test? What is going to happen? Or what if the roof of your laboratory takes off with a strong wind? There has to be a response plan that is going to take care of that. And that response plan actually should include elements of first aid, what kind of first aid equipment you're going to have, what are the procedures, just in the space, eye wash facilities, do they work? Do they have the right pressure for the water to come out? What kind of water supply do you have? Emergency showers. Emergency showers is a very big thing. If you're dealing with a lot of chemicals, you want to be able to have a shower where you could easily run into and get completely drenched. The standard to that is 40 gallons of water actually dropping on you all at about the same time. And then I mentioned the spill response. Do we have the right spill kits to respond to the different spills that we may have in our facilities? These are part of our emergency response that we need to look at to ensure that everything is going on well. So for today, basically what I'm actually looking at, I just wanted to look at a couple of elements in the ISO 15189. ISO 15189, as I said, has almost 18 different clauses. But my intent is not to overburden you with all the 18 clauses. So I just came down halfway into the clauses. And next time, not next week, but next time when we come back to talking about safety in medical laboratories, we still have the element of fire safety. What happens if there is a fire in the laboratory? Laboratory ergonomics, very important area, starting from how you're going to sit, how you stand, what is the height of the bench, how do you actually use the bench? Safe personnel work practices, what are the practices that personnel need to have? Protective equipment, we've spoken so much about PPE, the COVID era, there's been so much talk about the lack of PPE. Transport of samples and hazardous material is very important. Waste disposal, housekeeping practices, incident, injury, accident, and occupational illnesses. So these are some elements still in the medical laboratory space and safety that I haven't touched on yet because I didn't want to overburden. But we're going to look at this when we come back to do our second phase to the safety in medical laboratories. So at this juncture, I'm going to pause. I know there is so much to look at, and I've basically just made a quick introduction on the very important things that we need to think about in safety in the medical laboratory space. So if there's anybody with a comment or question at this time, I would be very glad to entertain some comments or questions with regard to safety in our medical laboratories and the era of COVID-19. Just raise your hand up and we'll be very glad to call you, and you could unmute and start speaking. Or if you're too shy to speak, just type in something and we'll try to read it out here. Okay. Any questions, any comments? Anybody can relate to something going on in their laboratory and they want us to discuss it for a few seconds? Okay. Well, I guess that would mean that this was simple and nice. As I said, anybody who is interested in the safety in medical laboratories, please go out there, get a standard, get a copy of the standard, the ISO 15190. It just got released in February of this year, if I remember right. So it's a very new standard. There is something just came in here. It says, when it comes to lab safety, it's a collective responsibility. How can labs sustain these safety procedures in a resource-limited setting? One of the big things that is going on today, if you're going to run a laboratory, again, as I said earlier on, the International Organization for Standardization comes up with these standards to be able to allow the activities to be the same, regardless of whether you're in a resource-poor country or not. Because we want to ensure, first of all, the safety of everybody in the space. This has nothing to do with the results, just ensuring the safety of the staff, ensuring the safety of visitors, ensuring the safety of patients who might be in the space. So in terms of the standard operating procedures, we need to do what it takes. Laboratory management has the responsibility of ensuring that every laboratory has the documentation that is required to ensure that every activity is done the exact same way by all the members in that laboratory. And that's really the basis for the Organization for Standardization, is ensuring that these activities are done the exact same way. And so laboratory management really needs to do whatever it takes to ensure that the procedures are there, that the people are trained, whether they are there as contract staff, full-time employees, or volunteers, or students, that they are actually trained to these procedures, they're familiar with the procedures, and they can actually execute whatever the expectation is of them without a secondary thought. So I'm not sure, that's James. I'm really not sure how you go around this. I think all laboratory management really needs to do, they need to make the sacrifices that are required to ensure that the procedures are available. They need to make the sacrifices that are required to make sure that everybody in the laboratory is trained and oriented in what is supposed to happen in that specific laboratory. When we spoke about the safety manual, one of the big things about the safety manual is it has to respond to the needs of that specific laboratory. So we cannot, for example, just have a national safety manual that we throw around all over the place. No, each safety manual has to respond to the need of that specific laboratory. Idris says, please elaborate on difference between the ISO 15189 and the ISO 15190. So the ISO 15189 is the standard that actually refers to quality and competence in a medical laboratory. And within quality and competence in a medical laboratory under ISO 15189, it basically has 7 sections, and it has the same scope, normative reference, and terms of definitions like all of the ISO standards. And then you have the clause 4, which directly looks at the management responsibilities. And within the management responsibilities, there are about 15 sub-clauses to that, that actually go, they start off with the responsibilities of the director, to the quality manager, to actually what is expected to be done by management to ensure the running of the lab. And then there is clause 5, which is the technical requirements, which actually looks at things like personnel. It looks at the environment in which the work is going to be done. It looks at the equipment that is going to be used. It looks at how are the samples going to be collected, what is the required for collection of the samples. It looks at the quality of testing, ensuring the quality of testing, which looks into the EQ, external quality assurance. It looks into internal quality controls. And then it goes on to talk about the actual testing itself and how the results are going to be managed and reported. So all of that actually just looks at what is the quality of the system and what is the competence of the people within that system. And then you have the ISO 15190, which basically in the same environment, the medical laboratory is actually looking at what are your potential exposures? What is the risk that you're going to be dealing with that could potentially cause harm to A, the staff, to visitors, to patients, or other stakeholders who might be in the space? And so you're looking at things, if you're talking about just the staff, you're looking at things like ergonomics. Do they have the right chairs? You're looking at emergency response. What is going to be, if there was a hazard that occurred in the lab and the hazard team had to respond, the hazmat team has to respond. How do they come when they come to respond? So the difference between the two, one actually 15189 looks at the quality and competencies of that laboratory to carry out the testing within its scope. And ISO 15190 actually looks at what are the safety requirements for you to be able to carry out the testing within that particular medical laboratory. Thanks, Idris. Any other comments or questions? We'll be glad to take at this time. One more coming here. Let's see. From your presentation, I realized there are quite a number of ISO standards to implement by medical laboratories simultaneously. Is there an ISO standard or guidelines which can help us integrate them during implementation? If yes, which one? If no? Yes, there are a number of standards that are available, but there is no specific guide that tells you which one to implement. Again, it depends on the complexity of your laboratory. If you're running a very high complex laboratory, again, you have to think about, as I said, the ISO 45001, which are the OSHA requirements. If you're going to have a soluble waste, liquid waste, you need to think about ISO 14001 because it has direct impact on the environment, what is going to happen. If you're going to, you have data which you have to move from one place to the next. If you're dealing with an electronic system, again, you have to look at ISO 27001, which manages the information security. So there are different standards that you have to look at. And all of this, by the way, is based on ISO 9001, which actually just ensures that you have a good quality management system. So it actually depends on what the management team at your laboratory is trying to get at. That's what is going to guide them with what standards they want to use and how they want to be involved in those different standards. But yeah, there are a number of standards, and depending on your involvement, you'll be able to choose which standard to use and at what point and what its actual utility. Thank you. Okay, we have time for just one more question, one more comment. If there is anybody with one, I'll be glad to take it at this time. If not, I would move on and say, as always, I never want to end one of these without reminding you that COVID-19 is real. It's still very available. There is the conversation now about the new surge, and everybody is talking about the new surge. And the only reason why there is the conversation about the new surge is because of our own compliance. We still have not been as compliant as we should be. And there are standards around compliance. So I urge everybody to please look out for your temperatures. Make sure that you know how your body feels. Wash your hands is always the preferred one. Wash your hands for at least 20 seconds with soap and running water. If you don't have soap and running water, please, you could sanitize as many times as possible. And always have some kind of a face wear or a face mask, depending on where you are in the world. Please have something that protects your nostrils, your mouth, and hard to say your eyes. In my case, I put on glasses, so my eyes are protected, but please have a face mask to protect your nostrils and your mouth. The COVID-19 is airborne, and so we want to protect it from coming in. And in spite of all of that, we want to continue maintaining our social distances. And now that people are going to start traveling, please just make sure that there is enough space between yourself and the next person. And if you're going to reach us, please, you can reach us through one of these. We'll be very glad to talk about safety in your medical laboratories, and we'll be very glad to help you attain and meet and get certification around any of the standards you want to ensure the quality and competence of your laboratory and or safety and or the occupational health of your people. Look forward to having that conversation with you. Till then, see you next week, same time, same place. Have a wonderful week.